Let's discuss REN4, gate of the source, Guanyuan, a front collecting point or an alarm point. REN4 is located on the anterior midline, two-tsун superior to the upper border of the pubic symphysis or three-tsún inferior to the umbilicus. How to find REN4? The distance between the center of the umbilicus and the upper border of the pubic symphysis is divided into 5 tsún, which can vary considerably from the patient's finger tsún. Therefore, only proportional tsún measurement should be used here. A helpful device would be an elastic tape. REN4 is located on the midline, either 2 tsún superior to the midpoint of the upper border of the pubic symphysis or 3 tsún inferior to the umbilicus. Located on the same level are kidney 13, 0.5 tsún lateral to the midline, stomach 28, 2 tsún lateral to the midline, and 3 extra points, extra CA, which is I Ching, 1 tsún lateral to the midline, Chimen, 3 tsún lateral to the midline, Tituo, 4 tsún lateral to the midline. Also located on approximately this level is GB27, which is medial to the anterior superior iliac spine. Needling of REN4, vertically 0.5 to 1.2 tsún. Caution, peritoneum. Needling contraindicated during pregnancy. Actions or indications of REN4: tonifies original qi or yuan qi, benefits essence or jing, strengthens and nourishes kidneys as well as blood and yin, eliminates cold and dampness from the lower burner, especially with moxibustion. Special features: front midpoint of the small intestine, meeting point with the spleen, kidney, and liver channels, important point for tonification, major point for urogenital disorders, especially gynecological disorders. REN4 is an extremely important point. It is one of the most powerful points to tonify qi and blood and strengthen the body and mind. First of all, it can be used to tonify blood and yin in any pattern of deficiency of blood and or yin. It nourishes yin firstly because a directing vessel controls all the yin channels, and secondly because REN4 is the meeting point of the directing vessel with the liver, spleen, and kidney channels. Dark phase is a sign of kidney yin deficiency. REN4 also strengthens the yang when used with direct moxibustion and can be used in this way to rescue the yang in the acute stages of windstroke due to collapse of yang. It can therefore be used in any pattern from yang deficiency, particularly kidney yang. REN4 is probably the main point to affect the uterus and menstruation, so that it is used for most menstrual disorders, such as amenorrhea, scanty periods, irregular periods, or heavy periods. REN4 also has a long history of use for infertility. In menstrual problems and in gynecological problems in general, use REN4 in combination with the opening points of the directing vessel, lung 7 and kidney 6. It tonifies kidneys and original qi, yuan qi, and is a very powerful point to strengthen the general level of energy and the kidneys. It is thus an important point to treat chronic diseases or patients with a poor constitution. REN4 can tonify both kidney yang with direct moxibustion and kidney yin. REN4 can calm the mind and settle the ethereal soul by nourishing blood and yin. It can strengthen the lower burner in persons who are very anxious, especially if such anxiety derives from yin deficiency. REN4 tonifies qi of the lower burner, thus rooting the qi downwards and subduing rising of qi to the head, which happens in severe anxiety. In this way, it has a powerful calming effect. REN4 can root the ethereal soul and can be used for a vague feeling of fear at night, which is said to be due to floating of the ethereal soul. Its kidney tonic action extends also to that of strengthening kidneys receiving of qi, so that REN4 is an important point to tonify kidneys in chronic asthma. In such cases, REN4 is often combined with kidney 13. Some of the indications for REN4 pertain to penetrating vessel, as this vessel goes through REN4. Penetrating vessel indications for REN4 are feeling of cold in the lower abdomen, running piglet syndrome, abdominal fullness, and umbilical pain. When used to subdue rebellious qi in the penetrating vessel, we combine REN4 with the opening points of the penetrating vessel, that is spleen 4 and pericardium 6. REN4 also affects the bladder and is used for similar problems as those indicated under REN3. Although both REN3 and REN4 affect both bladder and uterus, we use REN3 more for bladder problems and REN4 more for the uterus. REN4 is probably the most important tonic point of the body as it tonifies all forms of qi as follows. Qi, yang, blood, yin, essence, original qi, kidney yin and kidney yang, directing vessel and penetrating vessel, defensive qi, and nutritive qi. Summary of functions: REN4 nourishes blood and yin, strengthens the kidneys, so good for lower backache, weak knees, dizziness, tinnitus, feeling of cold in the back, dark face, frequent urination, impotence. Strengthens the uterus and regulates menstruation, so it's very good for infertility, cold sensation in the vagina, amenorrhea, bleeding in pregnancy, persistent lochial discharge. And REN4 benefits original qi. REN4 benefits the bladder, so it's good. It's indicated for retention of urine, dark urine, painful urination, blood in the urine. Subdues rebellious qi in the penetrating vessel, like feeling of cold in the lower abdomen, running piglet syndrome, abdominal fullness, umbilical pain. Regulates the small intestine, so indicated for diarrhea, undigested food in the stools, incontinence of stools in the elderly. REN4 strengthens the kidneys receiving of qi, like cough, coughing of blood, breathlessness. And finally, REN4 roots the mind and the ethereal soul. So it's very good for fear, fright, and insomnia.